Good morning, everybody. Welcome to our webinar today. My name is Mary Beth Goodwin, and I'm a Senior Program Officer here at Delta Dental of Colorado Foundation. And I want to thank you for your time today, where we will talk about our second round of available grant funding through our 2019 open funding opportunity. So before we launch into our webinar content, I want to take a little bit of time to give a little background about me. I have been here at Delta Dental of Colorado Foundation for 1 year this month, which is very exciting. And prior to this role, I have worked in the nonprofit sector for more than 12 years, both in fundraising and in philanthropy, mostly with a focus on public health related work. I'm passionate about community health, and I'm so honored to be in a role where I can work with and learn from committed community members like you every day. Just recently, I've had the privilege of experiencing Cavity Free at 3 in action through Chaffee County's oral health program at a Head Start Center in Salida, and just came back from meeting with some community partners in the San Luis Valley that are working together to increase access to dental services for their communities. So as we dive into our main content, I just want to say how appreciative I am of the work that you all do across Colorado. And I'm really looking forward to getting to know you and your community in the future. Okay, so let's get started. Today, I will share information on Delta Dental of Colorado Foundation and then get into detail on our open funding opportunity with grant applications due by July 15th. At the end of my presentation, I will save time for questions, and you can submit questions at any time through typing into the questions box. And if you feel comfortable, when you're submitting your question, feel free to include who you are and where you're calling in from. Please note that this webinar is being recorded and will be posted on our website this week for your future reference. And you will also receive an email with the recorded webinar, as well as some additional follow-up resources from us. So our mission here at the Foundation is to elevate the well-being of all Coloradans by advancing oral health equity. We are focused on reducing disparities and increasing equity, and I will speak to this more in just a moment. We are the only Colorado foundation that is solely focused on improving oral health. And annually, we invest around $5 million statewide. As part of this, we provide 3 different avenues for grant funding. We have our invited grants, our initiative grants, such as the Colorado Medical Dental Integration Project, which you can find more information about on our website, and then our open funding, which is the focus of this webinar today. So what is oral health equity? We define oral health equity as every person can have a healthy mouth because the necessary resources are attainable regardless of life circumstances. I know many of you work in and are very familiar with the social determinants of health. Our foundation recognizes the significance of these and that a variety of factors determine an individual's oral and overall health status. We know that factors such as where someone lives, one's age, income, education level, access to resources, or racial and ethnic background can lead to real barriers to accessing dental care and achieving good oral health. And further, each of these circumstances or systems, access to coverage, care, employment, housing, transportation, can present either opportunities or barriers that can positively or negatively impact someone's oral and overall health. Our mission is what drives us every day because we know that significant oral health inequities exist, and particularly among low-income, racial and ethnic minority groups, those living in medically and dentally underserved rural and urban areas, and groups such as pregnant women, children, and older adults. So this is our theory of change at the Foundation. Our work is grounded in the idea that by tapping into multiple tools and leveraging strong foundations, our goals of access to care, prevention, and connecting oral health to overall health for those experiencing inequities improves the well-being of all Coloradans and our communities. Within our theory of change, our foundation is focused on 3 strategic priorities: access to care, prevention, and the connection of oral health to overall health. The current funding opportunity that we're talking about today can address one or more of these focus areas in your application. Each strategic priority has its own goal and focus population. Our access to care priority focuses on a number of overlooked populations and across the age span. Our prevention of tooth decay priority focuses on children ages 0 to 6, students up to 4th grade, and pregnant women. And finally, our connections to overall health priority focuses on older adults ages 60 and older. The specific goals and focus population for this focus area was not yet finalized in 2018 for those of you who we've talked to before. So this is a new focus area to apply for through the foundation in 2019's round of funding. Within each of our strategic priorities, we are focused on advancing specific objectives and indicators. And I know that there's a lot of info here on this slide, and so it is available for you to review in detail on our website. So for example, in each of our 3 priority areas, we have an objective specific to supporting community-identified solutions. These solutions may seek to increase access to care in rural counties and among underserved populations, or promote and expand oral health education and services among low-income children, pregnant women, or older adults. And again, the information in this slide and these evaluation objectives are available on our website at www.deltadentalcofoundation.org under the mission page in our About Us section. So please take a moment to check it out. So this map represents which counties Delta Dental of Colorado Foundation has an active presence in. And currently, we're in 35 of Colorado's 64 counties. And our goal, with your help, is to continue broadening our statewide reach, because we know that 7 Colorado counties lack dental services, which means no practicing dentist or dental clinic. 10 counties have limited dental services, which means 2 or fewer practicing dentists or dental clinics. Each year, we reach more Colorado counties through our foundation grant making and our company community engagement activities. Through the foundation, as I mentioned before, we lead initiatives like the Colorado Medical Dental Integration, or COMDI project, and Land of Smiles. And through our community engagement activities, we provide donations, sponsorships, toothbrush donations, and also support board leadership on nonprofits serving Colorado's communities. So before we share more about the 2019 open round of funding, I just want to provide a high-level summary of 2018's round of open funding. 2018 was our inaugural round of funding. It was the first time the foundation had done this. And it was the product of the foundation's strategic planning process and our board wanting to hear directly from the community what challenges they see specific to oral health and how communities are addressing these barriers. So in 2019, we had 61 applications submitted. 29 of those grants were awarded, so just a little less than 50% of grants were awarded in the end. Grants ranged anywhere from a total of $30,000 up to $300,000 and up to 3 years. There was a statewide reach, a focus on low-income populations, and of course those addressing oral health inequities, and a wide variety of strategies through grants were supported. So as we head into this year's round of open funding, we continue to strongly value that communities best understand the oral health challenges within their own communities and are thereby best equipped to create and implement effective solutions to those challenges. We are seeking your best ideas to improve oral health, be they implementing proven, perhaps more traditional programs, addressing emerging opportunities, or testing innovative approaches. So we accept and consider both programmatic and operating support grants. And we also understand that general operating support can be very hard to come by, yet it is often what is most needed by community organizations. We will consider operating requests, and within your application, you can speak to how oral health is addressed in your organization's overall priorities. All proposals must align with one or more of the strategic priorities that were discussed earlier in the webinar. So access to care, prevention of tooth decay, or connections to overall health. And as mentioned previously, we seek both proven and innovative approaches to advancing oral health equity. Strong proposals will include data, both qualitative and quantitative, either directly related to the program seeking funding and/or data related to the community need. We will consider both community-based and clinic-based interventions, as well as oral health education and promotion programs. To qualify for a grant, the applicant organization must be a 501c3 or 501c4 organization serving the people of Colorado, or a publicly funded state or local government agency or school. You may also be a new organization without your 501c3 status, and in that case, you can apply using a fiscal sponsor who is a qualified 501c3 or 501c4 organization. This list covers what we will not fund. It can also be found in our grant guidelines available on our website for further review. For those of you who attended our webinar or were interested in our funding in 2018, note that we have added a few items or clarifying items to this list based off of your feedback from last year. So for example, we've included building construction and renovations, transportation vehicles such as a dental van, and fundraising campaigns. And I'll pause here for just one moment as we continue on to a next slide of further things that we will not fund. And here, I just want to note we've added public policy work and water filling stations among the other items listed. So when applying, things to keep in mind. You may request up to 3 years of support in this round of funding, and applications may request anywhere between $10,000 up to $100,000 per year of the application. Also, requests may be no more than 20% of your organization's total fiscal year budget, and only one application per organization can be submitted. So what does the application process and experience look like? So we do use an online grants management system called Foundant to accept applications, and you can see the link here. You can also find a link on our website and through our grant guidelines, also on our website. Once you've logged into the system by creating a new account or accessing an existing account, you can work on your application and it'll save throughout. Application content will cover things such as general organization information, some demographic information, a description of your community need, your proposed activities, your alignment with the Delta Dental of Colorado Foundation's mission to advance oral health equity, and how you plan to track and evaluate your outcomes. You'll also be asked to upload some documents, such as financial statements and an annual organization budget. I also want to take a moment here to just note a new application or new question that we've added to our application this year. The question is, tell us about your organization's overall financial health and your availability and access to resources that may or may not be demonstrated in your organization's financial statements. This is an optional question, so I do want you to know that. However, our intent here is to learn from you what might not be fully explained in your financial statements. For example, you might have access to human, social, and intellectual capital in your community that doesn't show up as dollars and cents on your financial statements. Or you might have a really healthy cash reserve that's being saved for a significant capital, expense, or campaign coming up. We want you to feel comfortable in sharing this type of information with us, simply to start a conversation and help us better understand your big picture. So here's the overall timeline for the next several months. So June 1st, you're all aware that the funding officially opened. July 15th is the application deadline. If you don't meet the initial criteria of those items that were listed at things that we do not fund, you'll be notified by mid-August that you will not be moving forward in the process. Otherwise, our goal is to conduct site visits with each and every applicant late August through September. November 30th, final decisions will be announced, and by December 15th, the grant period starts. So now we're going to open it up for questions that have been submitted through the questions box. And to help facilitate this portion of the webinar, I'd like to introduce my colleague, Veronica Contreras-Dorea, our communications and graphic design specialist here at the Delta Dental of Colorado Foundation.
Hi there, everyone. So I'm just going to be reading out the questions that are submitted via our questions box. So you'll see it on your panel. We're going to start with Karen. Hi, I'm Karen Harding, Director of Development for Rocky Mountain Cares. The proposal asks how else the foundation could partner with organizations other than funding. Can you tell us what other activities you could do so we can see what would be a good fit?
I'm sorry, can you repeat the question? I'm having a little bit of...
Sure. So just talking about how we mentioned that we can partner with organizations other than funding.
Oh, sure. Thank you for your question. So through our community engagement through the company, as I mentioned, we do some different sponsorships, donations, board leadership in Colorado's communities. So those would be all things outside of grant funding. In addition to that, through the foundation, outside of grants, you're always welcome to reach out to us, give us a call, email us. And if there's an opportunity that you think that we might be able to partner together that doesn't involve grant funding, we are more than happy to have a conversation about your needs and how we might be able to partner.
Okay, and the next question is, can we run our ideas past you before developing our application, or if we have any additional questions?
Of course. We really encourage you to contact us, and I know I've heard from several of you already. I've been loving the conversations. Our other two program officers on our staff have also been so excited to talk to you. We can be reached multiple ways. We can be reached via email at grants@ddpco.com, or you're welcome to call me directly at 303-889-8633. We also have additional information on our website, as I've mentioned, to include our grant guidelines, our focus areas, our objectives and indicators. And then finally, you'll be receiving an email after this webinar today that includes the recorded webinar that you're welcome to review again and forward along to anyone that you think might be interested, in addition to some other resources. And all of our contact information is also available on our website.
Okay, our next question is from Danielle Felder, and she would ask, can you explain the pass-through organizations and what you mean and propose for that as an exclusion?
Yes. So that is a great question, and thank you so much for asking that. So we've had a few folks call about this because we understand that there are organizations that are either potentially associations where they might represent several different organizations within an umbrella of what you all do and provide technical assistance and capacity building to, for example, school-based health centers. So when we say pass-through organizations as something that we will not fund, what we mean by that is we provide, say it was a $100,000 grant, and we provide it to an organization who passes 100% of those grant funds on to somebody else. So we know that in the event, for example, for school-based health centers, there's an association that represents all of them or a portion of them across the state. We know that there will be some pass-through grant dollars that go directly to individual organizations. However, we also know that there's a lot of technical assistance, administrative support, consultative support that's also being provided, and that some of those dollars will stay at the primary applicant's organization.
Okay. And would improving access to healthy food, which does impact dental health, be considered for funding in this round?
Yes, definitely. I think that is something that we would definitely consider around healthy eating and active living. I would just, again, continue to note the focus areas that we've talked about today and also on our website. So again, each focus area is going to have an individual goal and a population that's being trying to reach. So for example, the connections to overall health focus area. If you're working with seniors age 60 and over, and you have some resources around healthy eating and active living, and you're wanting to either integrate or continue to support an oral health component in addition to that nutrition and likely other topics, that would definitely be something we would consider. But I'll just continue to redirect you back to those focus areas and those objectives and indicators available on our website. And again, please feel free to call us to discuss your proposal.
Okay, and we've got a request to go back to the previous slide with the due dates.
Okay.
And our next question is, if we currently have an awarded grant, can we apply during this cycle?
That's a great question. So yes, if you are an active current grantee of Delta Dental of Colorado Foundation, and I'm making the assumption that you received funding in 2018's round of open funding, you are eligible to apply again. First, I would encourage you to contact the foundation and your assigned program officer that is currently assigned to your active grant to further discuss your proposal. But then in addition to that, I would advise you in your application, you're in a bit of a tricky situation because you're only 6-7 months into your current first grant. So I think the challenge there will be just to be able to have enough information there to determine, how grant funding is working, what are some of the challenges that you're facing, and what is really working, and then include that as part of your application. And then following your application submission, you will work with a program officer to have a site visit and discuss your situation specifically.
All right, and our next question is from Molly Hanson. Will you fund capital projects that expand an organization's ability to increase access for oral health and dental services?
That's a great question. So as I mentioned in the will not fund criteria, so we will not fund building construction and renovations or capital campaigns. However, for example, if you already have a room or some kind of dental clinic that can be outfitted with dental equipment needs that you have, other operatory needs, or other items, we will consider proposals that outfit that room, for example.
Okay, and what looks to be our last question, please submit any others if you have them, is how do you define a program or project budget?
So that's a great question. So last year, based off of your feedback from some folks, we understand that not everybody's proposal is going to fit into this program that you have. Sometimes you just have a project, and it might span multiple programs, or it might be general operating. In that event, when you're submitting your program or project budget, what we're looking for there is just the total costs that are associated with delivering your overall program services or overall program budget. And depending on your situation, that may mean that you're requesting 100% of those costs from Delta Dental of Colorado Foundation's grant funding, or it may mean that you're requesting 20% of those costs from us, and you're able to demonstrate that you have other funds to support the remaining 80%, and there's other overall activities that may or may not be related to dental or oral health that you're seeking funding for. So again, I think it's just demonstrating your total overall costs, and then of that, what you're requesting foundation funds for.
Okay, and will you consider funding public policy or advocacy work?
That's also a great question. So through our open funding, through this funding, we will not fund work, that public policy work that's intended to change or propose specific public policy, whether it be through legislation or rules and regulations on a statewide or systems level. However, we would consider funding more locally driven education and awareness campaigns or activities. Such as maybe that's grassroots organizing, might be some leadership development or community development, and those community organizing activities that they may or may not lead to some statewide systems level or policy change in the future. But right now, the intent of that funding is really just to mobilize communities. And we encourage you, of course, again, to call us to discuss your specific proposal idea.
And this next question is from Ethan. Will large equipment services like a cone beam or a 3D pano be considered?
I'm sorry, can you repeat those items?
Yeah, it's just saying if large equipment services, for example, a cone beam or 3D pano, will be considered.
Sure. So we will consider the purchase of equipment, whatever that might be for you.
And what is your approach to and the requirements for evaluation?
Also a great question. So we have contracted with the Colorado Health Institute to support our broader evaluation activities, and especially for those grantees to receive open funding. We also understand that everyone's going to have a different approach to evaluation. Everyone has a different community and a different way about how they run their programs and their operations. With that said, as part of your application process, there will be a question about your intended outcomes and how you plan to measure and document your results. And then, again, understanding that everyone goes about things differently, if you were to receive funding, everyone will have some or at least one main requirement. So annual reports will be required, and again, those will be submitted through our online reporting system, and there will be one common form for all grantees. But again, it's broad or general enough that we want to capture all the great different things going on in communities and how different communities track them. There's also going to be we'll request your participation in a one-day learning network that will happen at some point throughout the year, simply as an opportunity to share best practices with each other, have some discussions, and just continue the momentum and the excitement around the oral health work that's being done across the state.
And how much funding is available? What is the average size grant?
So that's also a great question, and I know that's really tempting to want to know what the overall budget is for this year's funding. And so we're not disclosing the funding budget only because we don't feel like it's a super helpful metric. We just, with it being an open, competitive application process, we really don't know how many applications we'll receive in 2019. With that said, we are anticipating that 2019 will be as competitive, if not more competitive, than 2018's round of applications. And so I think the only comparison or only metric I can provide you are those numbers from 2018, just to give you a sense of what the response rate was. And so again, we received 61 applications across the state. We funded 29 of those in the end, so that's a little bit less than half of proposals were awarded. And we gave out about $3.5 million, and that includes those multi-year grants in there. So hopefully that's a bit of comparison that might help you with 2019's round of funding.
Will you fund staffing, for example, a half-time dentist?
Yes, we will definitely consider. We understand that people are the biggest asset. So we definitely understand that salary support and operating support are needed. So yes, we definitely would.
Okay, well, it looks like that is all of our questions for now. Please know that if you have any questions later on, we are absolutely available and we'd love to talk to you. So by no means is this the extent of your opportunity to ask us these questions. We're going to go ahead and get some time back in your schedules for today. And this recording will be available on our website, probably by the end of today, if not by the end of this week for certain. Anyone who was registered for this webinar will actually be sending a link out to you directly. Please feel free to share that with whoever may need it. And just know that we are here for you and so excited to see what your grant applications are. Have a great rest of your day, folks.